YesRX was formed to serve the residents of Michigan who are impacted by cancer. Our mission is to improve cancer medication access and eliminate cancer medication waste in our state. Since we formed in 2023, we've seen a 15 times increase in the need for this program, whether it's patients who are having trouble getting the cancer medication that they need, or patients or family members who want to donate cancer medication to another person. So the accessibility of the program has been able to really help those on both sides of the equation.
We are bringing together a group of individuals who are really responding to a need across our state. We know that we have a strong network and strong partners.
The value of YesRX really can't be understated. This is a service that we have been talking about in our practice, since I've been practicing, since I finished fellowship in 2005. Like, why don't we have this available? Patients used to ask me about it all the time. I have these prescriptions. I don't want to throw away these medicines that I spent all this money on. Can't someone else use it? With the development of YesRX, what I've seen on both ends are the patients who are relieved that they can give their medications when they're no longer needed, but also for those patients who, okay, if we can't get this prescription quickly for her, can we buy her some time with a supply from YesRX? And knowing that that's there just takes one less thing off of the patient's plate, one little thing that we can relieve in a world of a lot of weight for them, right, in terms of all of the things that go along with having a cancer diagnosis.
What we see on a daily basis at YesRX is the complexities that patients face just trying to get their medication that they need. And patients don't have time for a delay. They need to stay on their treatment so that it's the most effective.
Over the past several years in the treatment of cancer, we've seen that the cost of therapy just continues to rise. And we're seeing more and more cancer patients and their family members in our communities facing the consequences of that financial toxicity. In essence, being faced with deciding if they're going to pay for their cancer medication or for their groceries that week.
All of a sudden, there was medication. It came to me. I said, well, how did I get this? What was going on? They said, well, there's an organization called YesRX that provides free care for cancer patients. And I said, well, what does it cost? How do I compensate? And they said, there is no compensation. It's free. The drug was so effective that my cancer was in remediation.
I guess my ask would be that, in the state of Michigan, that we're advocating for patients for longer supplies and limiting all of these barriers that we've created for people because of cost, right? And it's not their fault that that's how these drugs are, but we need to kind of take those down. And I do think YesRX fills that gap for so many patients.
What has given me so much hope is seeing healthcare providers and clinicians and team members across the entire state coming together for one shared goal to really improve our residents' outcomes and care, and to also decrease the waste that we see in cancer medication.
I think that we should be proud as a state that we're cooperating together across all sites. It's not one site that's taking advantage of this, but that we're really helping each other take care of the patients with cancer in the state of Michigan.
The medication is there available for you, and it is free. And I hope that others will hear this, advise friends if they have a need, resource, reach out, because it is there for us.